everybody, welcome back. Dr. Bacon here. Today we're talking about a really big problem that happens on a regular basis, and that is how to break through the fitness plateaus. And literally what this is, plateaus is a period when individuals stop seeing progress in their fitness goals despite continuing effort. So in other words, you're just going and going and going, but man, you just plateaued. And this is why we see some of these plateaus. Let's look at this really quick and kind of go over it. Adaptation. Obviously, you've been doing the same things over and over. Your body's getting used to it, and you're not gaining any more muscle. You're kind of right where you are. Got it? That's the adaptation. The body's going to adapt until you're no longer alive, and it stops adapting. Got it? Lack of increased effort. It's really more about understanding if you're doing the same things over and over, and maybe it's time to you've kind of plateaued at this area. That lack of effort kind of makes you go, I'm good right where I'm at. Even though we're frustrated because we haven't really seen the gains that we really want, and we're kind of stuck. Nutritional factors. Obviously, nutrition plays a role. If you're not getting the nutrients in that you need to rebuild the tissue, you're going to kind of feel the plateau also. And then recovery issues. This is going to be more about what you're not doing to help your body regenerate the tissue that you're breaking down on a regular basis while you're working out. And this is micro trauma to the system and understanding what you can do to build that back up. Doing exercise and functional movement is not breaking down the body to the point where you're going to have problems with pain and discomfort. It's more like I just don't give the body enough nutrients and enough time to let it rebuild and recover. So, some of the strategies to overcome this. Changing up the routine. Fit in 10, we've already done that for you. We've given you a bunch of different dynamic movements, dynamic activities that you can choose, and you can kind of incorporate different ones. It's really important for you to be dynamic with these challenges for your body, so you're constantly, remember muscle confusion and all that stuff that used to go on? It's the same idea. It's literally just putting more activities dynamically, differently into the system so your body has something to challenge it with. Next one would be progressive overload. Maybe putting a little bit more weight on there. You can't stay at the same level. Or if you've done a mile a bunch of times and you're really good at it, maybe it's doing some sprints for a little bit. Or maybe it's doing a 2-mile run and see how your body adapts to that. The next thing would be focusing on nutrition. In the challenge, not only do we talk about exercise and movement, we also talk about nutrition a lot because it's such a huge component of you being well and healthy. So making sure in the program we have meal plans, we have dietary recommendations, we have nutritional guidelines for people with certain conditions. There's a lot in that program. You should check it out. Also, set new goals. Always a big idea. Trying to kind of come up with more things that you can do, like maybe I want to do more push-ups, or maybe I want to do more body squats or more burpees. And then set a challenge to it. Set yourself up for that. Fit in 10, it's in there. And then incorporate the recovery. This is where, for me, it's as a doctor, I'm going to look for PMF, massage, other things that give your body a chance. Good sleep and rest. It's very important. These are things that you got to do on your own. And so for us, in the challenge, we help you navigate all of these problems and keep you on track to moving in a direction that's always 1% better every day. So we'll see you inside the challenge.